was to use a one word to summarize I would call it the health architecture on the continent, and I would use neglected or orphaned. I think orphaned,
Mm-hmm.
and I
I
use the
use the
term
term
orphaned
orphaned
because
because
nobody
nobody
owns
owns
it.
it.
Nobody
Nobody
takes
takes
responsibility
responsibility
for the
for the
Africa's
Africa's
for
for
health
health
experience on
experience
the
on the
continent.
continent.
It's
Yeah.
It's
never.
never.
I mean,
I
you
mean,
can
you can
count on
count
one
on one
hand the
hand the
number
number
of
of
elections where
elections where
health has
health
been
has
a
been a
manifesto
manifesto
issue
issue
on the
on the
in
in
or
or
any of
any
the
of the
African
African
countries.
countries.
So it's
So it's
orphaned.
orphaned.
It's
It's
neglected.
neglected.
It's
It's
considered
considered
inconsequential.
inconsequential.
Now, that's something that I would hope that the experience of the pandemic, if nothing else before then, should have changed. As in, we realize that if you didn't know it before, we all know now that if health isn't sorted, if the health system isn't in order, everything else can fall apart. But whether that lesson has truly been learned, I call
I
myself
myself
a pragmatic optimist usually, but with this one, I am more veering towards the pessimist side. I don't think the health system still orphaned. Health in its broadest sense, not just in the health care delivery mechanisms, is an orphaned
orphaned
topic on the
topic on the
continent.
continent.
In the
In the
UK, you
UK, you
can't
can't
win
win
a
a
local
local
election if
election
you
if you
don't
don't
have
have
a point of
point of
view on
view
the
on the
health
health
system.
system.
You
You
can't.
can't.
You
You
have to
have
have
to
a
have a
point of
point
view.
of view.
So the
So the
electorate there
electorate there
will
will
hold you
hold
to
you to
account.
account.
Our
Our
citizens,
citizens,
and
and
you
you
name
name
whichever
whichever
country
country you
you're
are, you're
talking
talking
about,
about,
maybe there may
maybe
be
there may
one
be
or
one
two
or two
exceptions,
exceptions,
don't
don't
actually
actually
realize
realize
that
that
health
health
and
and
access to
access to
health and
health
the
and the
infrastructure
infrastructure
to
to
enable
enable
them to
them to
seek
seek
the
the
best
best
quality
quality
health
health
experience in
experience.
their lives is a political responsibility, and it's one that governments owe them. So they don't hold governments to account, and therefore governments don't bother. So yeah, that I think that the key challenge is the fact that health is orphaned. It's the responsibility sits on individuals and their families, and that's why we talk a lot about remittances and the amount of funds that the diaspora remits back to Africa, but that almost always goes to individuals for managing significantly health challenges that shouldn't be a problem if the electorate and therefore their elected governments actually took ownership of the duty to deliver a positive health experience. I mean, you only need to look at the Abuja Declaration, which is almost 30 years old now, and we still, granted, you can argue about whether that 15% level was a practical one, 15% of your annual budget, and what is health expenditure as defined in that statement. But nevertheless, we haven't spent anywhere near that amount. I think there's only two or three countries at one
One
point who
point
have
we've
managed to
managed to
reach
reach
that.
that.
So
So
I think orphaned is the term I would take.
I think you've also made a very important point with respect to having a diverse health system. Some in the early phase, others in a relatively better position, and also the issue of political will. I think is very very important, as you've highlighted. As usual, citizens are more concerned about daily economic issues rather than health. So they want policies that will directly bring some financial relief to them, immediate financial relief, and I think that is something that we have to look at.